Hi everybody, this is Dr. Gonzalez. In this video, I want to review for Texas residents, specifically the certification and licensure process, which occurs after graduation. Let's go ahead and get started. So the process that you're going to follow post-graduation is outlined in the next few slides. So your first thing is you will apply for certification and licensure at the same time. The Board of Nursing will begin processing your paperwork immediately, but your file will be pended until the Board of Nursing receives all of the required information. Once your application is reviewed by the certifying body, which will most likely be ANCC, you will get a letter called Eligibility to Test. It will give you instructions on how to set your test time. Mark on your application that you send to ANCC to send the results directly to the Board of Nursing. And that way they will, once you've finished taking certification, they will send the results automatically to the Board of Nursing. Make sure to take a review course that will be very helpful, and then take your certification exam. That's the general process. So when the Board of Nursing gets your transcripts and verification of education and certification results, they will complete processing your application and issue a license and RX number. Once you have a job and a supervising physician, you must then register with the Texas Medical Board. Physicians are required to report to whom they delegate prescriptive authority, and this is done electronically, and you have to go to the Texas Medical Board website and open an account on their website. You cannot do this prior to having a supervising physician because you have to enter the supervising physician, and you cannot do this until you have prescriptive authority and a license from the Board of Nursing. So when you open the account, the physician will get notified and they will need to complete their portion of the process electronically. They can delete dangerous drugs and or scheduled drugs. So they can say on their side whether they want to delegate to you dangerous drugs or scheduled drugs. If they only mark dangerous drugs, then you cannot prescribe scheduled medications. Make sure they mark the correct options. So if they want you to be able to prescribe blood pressure medicines and medications for hyperlipidemia, etc., then they need to make sure that they check dangerous drugs. Sometimes physicians don't understand what dangerous drugs means, and that is all the general medications that we prescribe on a daily basis, such as antibiotics and antihypertensives, etc. If they don't mark dangerous drugs, then you cannot prescribe all those medications. And so I've been in that experience before where the physician has only marked scheduled drugs and declined dangerous drugs, and I had to go back and correct them. So it's important that you know that so that you can direct the physician accordingly. If your delegating physician wants you to prescribe scheduled medications and he has reported to the medical board that they are delegating this action to you, then at that point you can apply for a DEA. You cannot apply for a DEA unless the physician is delegating that for you, because the DEA will look you up on the Texas Medical Board website and make sure that you're being delegated the prescribing of scheduled medications before they issue you a DEA. So the DEA application is done online. It costs around $750 and it has to be renewed every 3 years. There are some exceptions to that for the DEA, and we've discussed that before in the scope of practice lecture, so I won't beat that up again. Just remember that there are some exceptions to the fee. Once you have a DEA, you can prescribe scheduled medications, but not before. You will need to make sure that you have the appropriate delegation protocol signed and filled out, and then you are ready to practice. So certification versus licensure. Certification is done by a nationally recognized and accredited organization that is on the list of approved organizations posted on the Board of Nursing. It is the validation of your education that you've received at UTA. All states but 2 require certification. California and New York do not require certification. In some instances, California does require certification, and typically those are for out-of-state out-of-state schools, or for a student that has gone to an out-of-state school. Licensure is the legal authority to practice, and that is granted by the Board of Nursing once they receive all your documentation. You have two options to sit for certification. For the adult gerontology acute care nurse practitioner students who are graduating, you can go through the American Nurses Credentialing Center, or the American Association of Critical Care Nurses. For ANCC, it is accepted in all states, and we from UTA will automatically send the paperwork to ANCC that we need to complete for them to verify your education, and there is nothing you have to do but other than complete your application. We know that there is a form that we have to fill out for them, and we will send it to them automatically. The American Association of Critical Care Nurses is accepted in most states. There are one or two states that are lacking behind in acceptance of this exam. If you choose to sit for their exam, then you need to let us know that, and we will fill out the form once we are made aware that you're taking that examination. For the adult gerontology primary care nurse practitioner students, they can sit through an exam through ANCC or the American Academy of Nurse Practitioners. Both are accepted in all states, and again, we will send paperwork to ANCC directly. The American Academy of Nurse Practitioners does not require paperwork from the school itself, signed by the school. They do require transcripts, but not another form from us like the other certifying bodies do. So certification exam options. We've already went through this, but this provides you the website where you can go to apply for certification. Certification exam eligibility criteria. You have to have an unrestricted license in the United States. You are required to have a graduate degree or a postmaster certificate. You have to graduate from an accredited program. You have to have a minimum of 500 hours of clinical in the specialty area, and you have to show that you had a separate assessment, pharmacology, pathophysiology courses. You've had to have content in health promotion, disease prevention, and the diagnosis and management of disease, and you have all that graduating from UTA. All certification boards accept online applications. All certification boards accept electronic transcripts directly from the university. Some certification boards require a form from the MP program verifying education, and ANCC and AACN are the only two for the adult GERI programs, whether you're acute or primary, that require a separate form to be completed by the program verifying the education on top of transcripts. Again, AAMP does not require that. ANCC and AAMP allow applicants to take the exams prior to the official transcripts indicating degree conferral. This requires submission of official transcripts twice. So be aware that if you choose to do this, you're going to spend extra money in transcripts, and it's not going to save you any additional time because they will not release exam results until the official final transcript has been received, which shows that your degree has been conferred. All certifying bodies will provide exam results directly to another body, such as the Board of Nursing. ANCC provides an expedited review process for an extra fee, so you can look at expediting your review of your application if you need to. American Nurses Credentialing Center application tips. Again, UTA, we will automatically fill out and send the verification of information form to ANCC. You will see what that form is when you open up your application. It will say verification of education on it. When you see that form, just know that that is what we at UTA are sending automatically. We send verification of everybody's education all together in one spreadsheet to ANCC. So your only responsibility is to make sure you open your account and apply for certification prior for us prior to us sending that spreadsheet. If you do not do this and we send the spreadsheet first with your name, then when you go to open up your application, you're going to get an email back from them saying we need your verification of education form. If that happens, then you need to call them and tell them tell them who your school was and tell them that you were on the spreadsheet that the school sent you, and then they will have to go back and manually look at it and correct it. Academic transcripts, make sure to obtain your official transcripts with your MSN or postmaster's degree certificate showing that it has been conferred. Those are the type of transcripts. The degree conferral is what you want to make sure that you send to the certifying body and to the Board of Nursing. If you are a postmaster certificate student, then you will also need to send your MSN transcript not just to the certifying bodies, but also to the Board of Nursing as well. It may take up to 4 weeks for the university to process and confer degrees and certificates, so make sure you have the transcripts sent directly to the Board of Nursing. The Texas Board of Nursing does not accept electronic transcripts, so you have to have it mailed. So when you request that transcript, make sure you request it being mailed to the Texas Board of Nursing. Send transcripts directly to the certifying body as well, and they accept electronic transcripts. Information you will need for your application. You will be asked who your school is accredited by, and our school is accredited by the Commission on Collegiate Nursing Education. The acronym is CCNE. Completion dates, you will need to know your completion date for your application for certification and for the Board of Nursing. The completion date varies with each semester, and we will post on Blackboard the completion date. So your transcripts with degree conferral will be available after the completion date, so don't request your transcripts before the completion date. Be aware that it may take a little bit longer for degree conferral. In some instances, it may take upwards of 4 to 6 weeks, but it typically is available around 2 weeks. And always keep an eye in MyMav to see if your transcript has conferred your degree or shows your degree conferral. You'll also need to know how many clinical hours you did, and for the MSN students who are in acute care, they completed 720, and for the MSN primary care students who are in the primary care students also completed 720 hours in the program. So your program will ask you, your applications will ask you how many clinical hours you completed, and this is the number you put. For postmaster certificate students, you may have completed fewer hours. If you are already a licensed nurse practitioner student, you likely completed 540 hours. If you were a postmaster certificate student who was not an NP, then you probably completed the full 720 hours. But you can figure this out by looking at which clinical courses you took, whether you were primary care or acute care. And so if it was clinical practice 1, if you took all 3 clinical practice our clinical courses, clinical practice 1, 2, and practicum, then you completed 720. If you only took clinical practice 2 and practicum, then you completed 540. The certification exams are computerized. You do have to obtain an authorization for examination. You will be given 90 days from the date of the eligibility to test letter to take your exam. It will give you instructions on that letter, and your test site and date and time is self-selected. And you will get the score immediately, and then official results will follow in a letter and or email. So in order to prepare, we do recommend that you take a review course that will help solidify all the knowledge that you got. You can get certification books and practice test questions and tapes, group and personal studies, and always practice in your area of specialty. One thing to remember is when you go to take this, it is what guidelines ask you to do, is what the textbook tells you to do. It's not going to be some obscure thing when you're looking for an answer. So don't let personal practice or what you see in practice get in your way. What they do in practice is not necessarily how you want to answer the certification questions, because practice does vary, and it has to vary based on the clinical scenario. Remember, just because you see it in clinical practice doesn't mean that that's the most appropriate thing to do. I'm not saying that's inappropriate, but for certification, it is by the book and by guidelines. So some Texas Board of Nursing application tips. You should have already watched the Board of Nursing webinar on APRN licensure. Your name with the Board of Nursing on your transcripts and your application for the certifying body must all be the same. Otherwise, the Board of Nursing will kick back your application. Do not submit your application to the Board of Nursing until after the completion date. When you sign the application, you are signing that you have completed the program. You have not officially completed until after the application or until after the completion date. Part 1 of the application is completed by you electronically. You will be asked how long it took you to complete the program. Just base the time on when you started and when you completed. Make sure to check if you are an MSN or Postmaster Certificate student. If you transferred courses in from another university, then you must provide the Board of Nursing with the transcript from the other university. Postmaster Certificate students must send to the Board of Nursing their MSN transcript and a transcript from UTA. If the online application ask you to type in the school's name, then type in the entire name. Do not use UTA, because UTA may mean UT Austin. You will be asked if you have completed 400 practice hours in the last 2 years. You can say yes to this question. You will also be asked if you have completed the required CEs, and you may say yes to this as well. Part 2 of the Texas Board of Nursing application form is completed by UTA, and we automatically send that to the Board of Nursing. You will need to sign Part 2 following the directions in Blackboard, and it is a release of information, and so you don't do anything with there's 2 portions of the Part 2 form, so you don't have to do anything with the first part, but the consent, which is on the second half of the Part 2 form, you need to sign that and send that to Rose Olivier, and then we will get those forms together and send them to the Board of Nursing. The Board of Nursing forms will be sent on the first business day after will be sent to the Board of Nursing on the first business day after the degree has been conferred. You can check on your Board of Nursing approval for licensure by going to the website and just looking up your license. When it's done, you will have ultimately 2 licenses. You will have an RN license and an NP license in your specialty, and you will have 2 separate license numbers. Again, forms that the college will send. We will send the validation advanced practice nursing education form electronically to the American Nurses Credentialing Center, and we will send to the Texas Board of Nursing automatically the Part 2 form, which is the verification of the completion of a program in advanced practice nursing role. Your credentials, upon graduation, you will have an MSN, and you can use your RN and MSN. Once you've passed certification and are licensed by the licensed as an NP by the Board of Nursing, then you can use your RN and MSN if you choose, and the NP title as you see on the screen. You always have to use the RN, or Texas Board of Nursing will allow you to use APRN as opposed to RN as well. But you always have to recognize or identify yourself as an RN in the state of Texas. So continued APRN requirements by the Board of Nursing. APRN licensure is renewed every 2 years, and you will renew it with your RN licensure. It will be due on your birthday in conjunction with the RN license. You do have to have 25 continuing education units, which includes some for prescriptive authority and additional CEs for if you prescribe controlled substances. If you maintain your national certification, which you do, the Board of Nursing will comp your 25 hours of CE, but you must make sure that you have the required farm hours and controlled substance hours and geriatric hours ethics hours and jurisprudence hours though. So even if you don't do the full 25, make sure at a minimum you have the specialty continuing education hours that are required by the board. Uh, Again, in order to renew your license, you have to have 400 hours of clinical practice as an NP every 2 years. You have to maintain your national certification, and your national certification certifying body does have specific continuing education requirements and practice hour requirements and other requirements that you have to meet in order to renew certification. Make sure that you maintain your prescriptive authority agreement or facility-based agreement and it's signed annually with your collaborating physician, and you have to keep those for 2 years. Again, you have to report to the prescriptive authority to the Texas Medical Board, and that's the website where you go to. Again, prescriptive authority in Texas, we can prescribe Schedule 3 through 4, and in some instances Schedule 2. Be aware of what those instances are. You have to have that DEA number, and you can apply for it from this website on your. After you graduate, if you print or save a clinical portfolio from what you inputted in InPlace, this is for your reference only. I recommend that you do that and have that available, because if you go for credentialing at the hospital, they may ask for that. Hospitals are now asking for that, so it's a good idea to keep that printed off and available in case you're asked. Let us know when you pass the exam. You can email me or the program director or Rose Olivier and let us know that you have a job and you've passed your certification exam. And make sure to keep in touch. We like hearing from you after you've left. You may not want to talk to us, but we do want to hear from you, and we wish you well and hope that you are doing good and are being successful at what you're doing. So a last review. Remember, your date of completion will be posted so on Blackboard as soon as we know it. Your program accreditation is done by CCNE. You have completed 41 semester credit hours if you're an MSN student. If you're a postmaster student, that will vary on the courses that you've had to take. Make sure you take a look at your transcript and see how many credit hours you completed. The number of clinical hours you completed if you're an MSN student is 720, and for postmaster certificate students it's going to be anywhere from 540 to 720. All right, that's the end of this review and lecture. Congratulations to you. I hope you have a great day.